A 24-year-old woman presents to the clinic with complaints of increasing nausea and mood swings occurring over the past 4 weeks. Past medical history significant for opioid dependency, HIV, and obsessive compulsive disorder. Current tobacco smoker with 1 pack per day and consumes alcoholic beverages 2 to 3 drinks per week. Current meds include methadone 30 milligrams by mouth daily and sertraline 100 milligrams of mouth daily. Patient appears thin and anxious upon presentation. Last menstrual cycle was reported at 6 weeks ago. She's negative for both hepatitis B and C. Her CD4 cell count is 546 cells per millimeter cubed. Her HIV RNA viral load is detected at 122,000 copies per millimeter cubed, which is above the threshold of 1,000. Serum HCG is elevated, and the ultrasound reveals normal fetal development at about 6 weeks gestation. To decrease the risk of transmission to the fetus, recommend initiating combo antiretroviral therapy. Initiate Truvada, emtricitabine 200 milligrams and tenofovir 300 milligrams 1 tablet by mouth daily. Initiate Icentris raltegravir 400 milligram tablet by mouth twice daily. Recommend that the patient's ALT, AST, and bilirubin be measured at baseline every 2 weeks upon initiation and then 6 months thereafter, or every 3 months thereafter. Recommend patients' viral load be measured every 2 weeks upon initiation, every 4 weeks until values are below the limit of detection of 200 copies per milliliter. Recommend that the patient's urinalysis be obtained at baseline and then every 6 months. Patients' HIV RNA levels are to be reviewed around 34 to 36 weeks gestation to assess the route of delivery of the baby. For women who have HIV RNA viral load levels of greater than 1,000 copies per milliliter near delivery, recommend a scheduled cesarean at about 38 weeks gestation. Recommend patient initiate prenatal vitamin 1 tablet by mouth daily. If any nausea experience, recommend diclegis 2 tablets by mouth at bedtime on an empty stomach. Recommend patient be counseled on tobacco cessation and alcohol avoidance. Recommend that the patient continue therapy for their opioid addiction and follow up with their specialist on that. Recommend that the baby be monitored for neonatal abstinence syndrome, including presentation of uncoordinated sucking reflexes, irritability, and high-pitched cries upon delivery. Breastfeeding is not recommended for the patient at this time. Recommend that the baby receive an HIV prophylaxis drug regimen initiation of 6-week zidovudine to reduce transmission. As far as the patient's OCD goes, recommend discontinuing her sertraline and following up with cognitive behavioral therapy, as all other meds pose risk to the baby.